Insurance Reform, Economic Development, and Senior Citizens now convenes this public hearing. Public hearing notices were given to the media. First notice on Wednesday, October 8th, 2014, and second notice on Friday, October 10th. For the record, today is Wednesday, October 15, 2014, and the time now is 3:32 p.m. The committee will hear and accept testimonies, both oral and written, on Bill 402-32, an act to provide for the coverage of blood and blood derivatives by health insurance company or health care provider contracted to provide private sector small or large group health plans. And so the committee has received written testimonies from the local insurance industry, as well as, I just mentioned, from Take Care Insurance, from Netcare, Stay Well, and we also received from the National Hemophilia Foundation and the Western States Regional Hemophilia Network. I'd like to now call on those who signed up and wish to provide oral testimony. When I call your name, can you please come up here to the table in front? Diana Santos, Mark Cosico, Paul Villacorta, Tanya Pangilinan, and Ms. Rosa Bala. Yes, please. I want to recognize Senator Santos, Francis Santos. Thank you for being here. For the record, sir, my shirt is pressed. Sorry? My shirt is pressed. Okay, that's right. Even mine. Okay, so. I'm always looking at my shirt now for that. Make sure. Great. Thank you very much for being here this afternoon. What this, just briefly, what this bill's about is to provide for the coverage of blood and blood derivatives by health insurance companies. This is a long-standing issue that we have been working closely with public health, with Rosa Bala, and it really has come to the forefront and really come up again during a few weeks ago. There was a hemophilia conference on Guam, and so this is something that we wanted to bring up and start the discussions. Mark has been the poster person for this effort, and so I thank you for being here. What this does is that we know that for GovGuam health insurance plans, even to a certain extent the federal plans, and maybe later we can get that clarified by the insurance companies, provide coverages for blood and blood derivatives, as well as the public programs, the MIP and Medicaid. And what we've seen from few of the people who have hemophilia is that you are able-bodied individuals that are able to work, want to work, but then are forced to quit your jobs, quit receiving income, for you and your family, and having to end up in public programs. And when that doesn't work out because maybe your spouse is also working and your income is still above the threshold to get into these programs, some of you resort to leaving off island and having to get treatment elsewhere, and leaving your families behind. And so, what we wanted to do was get it where you can still be employed and still be able to get that coverage in a private health plan in the commercial side. Okay, so we'll start with Ms. Santos. You can just state your name and who you're representing, if any, organization. Yeah, person.
Yes, I'm Diana Santos. I'm a social worker with Medical Social Services, and I also am a social worker for the Guam Comprehensive Hemophilia Care Program. And so I have a written testimony here on behalf of myself and Ms. Rosa Bala, who happens to be the program coordinator. Okay. First of all, Senator Rodriguez, I just want to thank you. We're really moved beyond words for your proposal of Bill 402-32. And as social workers, we are here to advocate on behalf of our bleeding disorders community and for the common good of Guam. Thank you for addressing the life-saving needs of those with congenital bleeding conditions and for those requiring the need of blood and blood derivatives in times of ill health and trauma. Medical research has proven and reported about the many life-sustaining functions of blood. The creation of this bill is almost like a dream come true for the patients we serve under the Guam Comprehensive Hemophilia Care Program, or the GCHCP, which operates out of the Department of Public Health and Social Services. Our data from last year's GCHCP clinics reported a total of 48 active patients, 27 males and 19 females, diagnosed with hemophilia and von Willebrand's disease. Half of these males have hemophilia of the severe type. As of now, only the government of Guam, the Medicaid, and the medically indigent program covers blood and blood products. About 37% of patients in our hemophilia registry are insured by private health insurances, which do not provide coverage for blood and blood derivatives, and 13% who are uninsured. As a result, these patients are left to forego prophylactic factor treatment because of the inability to afford such care. This also renders them extremely vulnerable to bleeding to death should they find themselves in a traumatic situation. Bruising and constant bleeding will ultimately damage their joints and may inevitably place them in physically disabling conditions. Instead of seeking immediate medical care that could alleviate and/or prevent further complications, they wait until they end up at the emergency room at the Guam Memorial Hospital, all because they are unable to afford blood and/or blood derivatives. This leads to poor states of health for our patients. Prevention and prompt treatment of bleeds via access to blood and/or blood derivatives are the keys to promoting healthier, longer, and happier lives for our patients. Subsequently, this will also give their families peace of mind, security, and happiness knowing that their loved ones are properly cared for and provided for. A number of our GCHCP patients express that they have a strong will and desire to live productive lives and advance themselves professionally. However, they feel like victims caught between a rock and a hard place. Should they work earning above the eligibility limits of the Medicaid and MIP programs, they fear of losing their coverage of their factor supply. They shouldn't have to live in a constant state of panic, fear, and worry. They shouldn't have to choose between life and death. Please make this dream of having private health insurance companies provide coverage for blood and blood derivatives a life-saving reality for our patients, their family members, our future generation, and for all on Guam. Blood and blood products are a necessity that we must ensure provision. All our lives depend on it. Thank you once again, Senator Rodriguez, for just hearing the cries of our patients and their families as well as the people of Guam. Thank you.
That was beautiful. Thank you for your time. This is like, how can I say, something that Rose has worked on for years, several years, and she's been able to get it passed through the public insurance programs to provide the coverage. And so now we're looking at broadening that coverage, and that would be beneficial to so many of our clients who face $10,000 bills, can't get a tooth extraction because they can't afford the prophylactic treatment and the after treatment after having an extraction. And how can I say it? It also helps them be able to be productive because that's what they want to do. But when limitations to be able to treat versus work, they need to treat. We want them to stay healthy. We want them to prevent disability. And we see that need now because some of our patients don't go with regular treatment. They don't get that infusion that they should get 3 times a week. So they're ending up on a very hard road here. But if the private insurance could cover them, then they would really benefit from having that program, that coverage. The parents will feel proud that they can help their child and not feel helpless. as Diane stated, that they're able to do more on their own. I look at even Medicare, the coverage is not complete, but with Stay Well helping satisfy that requirement, they won't be stuck with a $10,000 bill that affects their ability to get medication later on, because the companies won't release future doses without some sort of payment. So additional coverage would be beneficial to several families on the island. Thank you.
Thank you. Lynn, can you just state your name?
Yeah, My name is Lynn Okada.
Thank you.
Hi, Senator Dennis Rodriguez. I would like to say thank you for giving us a chance to speak out and voice out our concerns about having no factor or no coverage in the private sector. I just want to read a testimony that I just typed out. Okay. My name is Marcus Seco. I'm 32 years old, living with severe hemophilia. I'm married with 3 young kids and 1 child that is affected with the lifelong bleeding disorder. I try my best to provide and plan for a good future for my family. But it's really difficult to do that with one parent making income for a family of 5. The way I see things are going so far is the hemophilia community can really look forward to living life to its fullest. The reason why I say this is the point that currently all private sector health insurance companies on Guam do not cover our medication called Factor VIII. It's a must that we take our medication Factor VIII intravenously 3 times a week for life. This is called prophylaxis. It's a must that we do this to prevent serious bleeds and to maintain normal factor level in our body in case of any accidents, injuries, or spontaneous bleeds that may occur. Without proper medication, it may lead to more serious health complications and even become disabled. We want to prevent this from happening to us. There is no cure for hemophilia, just the Factor VIII we need to live a normal life. This medication is very expensive to pay out of our pocket and even to pay a small percentage of it, not even close to affordable. So we, the hemophilia families, will need to apply and go on Medicaid just to receive Factor VIII, because they are the only insurance that covers this 100%. I was working for the hospitality industry, hoping to climb up the ladder someday, but this was put on hold now. My wife already established herself at her current job, and I had no choice to resign from my job. If I kept my job and we still had 2 incomes, we wouldn't be qualified for Medicaid due to the monthly income bracket that we cannot exceed. It's very sad and unfortunate that I and others that are put in this position, not able to work, make money for our family, save for our kids' college fund, or in case of any emergency, just to qualify for Medicaid. Why force people with our situation to depend only on Medicaid for the benefit on just getting the medication to live a life like a normal person should? We don't want to depend on just Medicaid, especially if we're willing and able to find a full-time job that offers health insurance benefits and work hard to be a productive person in society and help contribute to the community of Guam by serving them. But I understand there are some of us that really can't work because their health already deteriorated, unfortunately, from hemophilia and other health conditions associated with this disease. I ask myself, what kind of future would my daughter and other families have living on Guam with hemophilia, knowing that they will need to deal with what I'm dealing with right now if this doesn't change? No choice and limitation is all I see here. It's unfair for Guam's fast-growing hemophilia community. Everyone should have the right to prosper. Every parent wants the best for their kids. I'm concerned for my daughter's future and the rest of the young kids with bleeding disorder because they won't have that opportunity to grow as a person with a mission in life. These are some of the struggles that I and other families face as a person with needs of blood and blood derivatives to live a healthy lifestyle. Please put yourself in our shoes and imagine. I hope and pray to see this bill introduced by Senator Dennis Rodriguez becomes a law so that we can provide a brighter future for ourselves and we can look forward to the opportunities to become successful in life for our growing hemophilia community without the fear of having no coverage of factor VIII in our workforce. Thank you.
Thank you very much. Paul?
Paul Villacorta. Going back to what Mark said, this doesn't really pertain to me because with my health, because of challenges that I face in life, I'm unable to work either government or private, but I can sympathize with all the other hemophilias or who are going through his struggle. Like they have to cut down their hours, or they have to quit work because they have to meet that income bracket of, qualifying for Medicaid or whatever insurance. And it's really unfair because, like he said, he has to provide for his family, support his kids and everything, and he can't do that with all of the challenges that he has to face just to get the medicine for him and his daughter. And I'm just here in hopes that this bill does get passed and we can get coverage for the hemophilia community and all the people who need it. Not only hemophilias, but like von Willebrand and all the other serious bleeding disorders with even mild or less than mild or whatever, what have you. That's it. Thank you.
Tanya?
Hi, yes, I'm Tanya Pangilinan. I actually am representing my son, Donovan Pangilinan. He has severe hemophilia. He is 10 years old right now. Let me give you a little bit about him. He was diagnosed with hemophilia at 3 months old. Being a parent, I didn't know anything about this disease. And I had to learn. I had to, learn about what it is, what the problems were. The struggles that I've had with my son having this was that throughout, since he was diagnosed, he's had many problems with bleeding, with joint injuries. There were some times when he was a toddler where he couldn't walk, he had to crawl, and he was walking already. He had to crawl places where he wanted to go all around the house. He had to be carried. Even at an older age, he had to do that. Swellings can be this big in a child's knee if it's really a bad injury. And we weren't able to get any kind of medication for him. This kind of goes to the line 3 on the bill. It starts on line 3 where it says that health insurance coverage of blood and blood derivatives is covered by Government of Guam and Federal Civil Service Health Plan. My husband works for the federal, so I wanted to kind of get a clarification on what part of the federal covers that, because we actually have take care insurance with the federal, but it states in the packet that blood and blood products are not covered. So we wanted to kind of get a clarification on what part or which federal agency health plan does cover that. Right now, the biggest struggle that I've had was last year. My son, well, he has been hospitalized a few times, but over a missing tooth. He actually lost a baby tooth. His mouth didn't want to stop bleeding for over a month. They kept trying to, his nurses worked with him, trying to give him the factor that he needed. Nothing worked. He had to be hospitalized, and the options that we got was whether we pack up and leave, or he has to get medevac, an emergency medevac, because he needed to stop the bleeding. So the only thing that came to us was that we need to give up guardianship over him for him to receive the medication that he needs. So that's the only option that we had. So my mother-in-law right now has guardianship over my son in order for him to survive through this disease that he has. So I just actually, I know it's about the private sector, but I just wanted to get that clarification if, if federal can cover it with whatever plan that we have.
Okay, thank you. And we'll invite the insurance industry representatives who are here later, and we can and we'll ask those questions. Thank you very much. Doc?
Thank you, Senator. I want to back up just a little bit. Hemophilia has been a problem on Guam for a long, long time. Now, we don't think about it much from way back because back before 30, 40 years ago, no male with hemophilia survived much beyond the age of 20, maybe to 30. Now, the ladies survived, and the ladies are the ones that carried hemophilia down to the next generations and the next generations. And we have a lot of senior ladies in our hemophilia community, but there are no senior men. Well, there's one, because they did not survive. And it wasn't thought of that much because there weren't very many people that survived with hemophilia. About 50 years ago, it was discovered that if they gave something out of fresh blood to a hemophiliac, he would stop bleeding. And it was discovered through some careful research by about 40 years ago, factor VIII, an enzyme found in the blood that's worked with stopping of bleeding. And hemophiliacs, by definition, are missing either that factor or another one, factor IX, and that's what causes them not to stop bleeding. When factor VIII became available, then the treatment of hemophilia, including that on Guam, became that of when somebody bled, you got them to the ER, and after much to do, they eventually would receive an infusion of factor VIII, which would slow their bleeding down, maybe stop it, and they were sent home. And that was it until the next time they bled. And this kept them alive. They weren't dying anymore. But all of those people, the damage done in their joints by that blood gave them severe, severe arthritises, and they were disabled. And there were very few hemophiliacs from that generation beyond the age of 20 who could hold any kind of gainful employment because they had such severe arthritis in both their arms, their legs, and their elbows, ankles, feet. About 20 years ago, a very nice lady by the name of Judith Baker, federal employee, took compassion upon Guam, and she brought modern hemophilia treatment to Guam. And then life changed from reacting to bleeds to preventing them. Now, when she started in 1995, we had probably 30 active bleeders on this island, give or take a few, most of which were under the age of about 15. A few were a little older, but most were under the age of 15. Now that generation has grown up, and today the treatment of hemophilia is we don't treat bleeds because we don't have bleeds. We've done lots and lots of things to prevent bleeds, including giving prophylactic factor, including all sorts of things with exercise, how to treat a bleed, how to be safe. We for 16 years have been having training every year intensely with these hemophiliac boys and their families, among other things, of how to treat and how to prevent bleeds and joint damage. And today, almost all of our people who are over the age of 30 have severe arthritis. Most of the kids that were kids back when we started are now in their 20s. They don't have arthritis. And they are able to work, except if they work, then they make money. And if they make money, they can't get Medicaid. And if they can't get Medicaid, they can't get factor. And if we want to be able to keep this community of children, not children anymore, of young adults, as being the productive members of this society they want to be. And there's a huge difference between what these kids are doing and what the kids one generation above them, most of which aren't with us anymore, were able to do. Just a huge difference. And as you see, those of our kids who don't have access to prophylactic factor, which is only a few, they're not growing up with the privilege of not having damaged joints. And that's something that they need to be able to have. Factor is undoubtedly expensive. Prophylactic factor is more expensive than just giving it to react to a bleed. But when you look at the long-term benefits, these kids don't need joint replacements. They're not on disability. They're not on the welfare rolls. They're not on disability payments. They're able to be productive people in life. And they're going to live a reasonably normal lifespan, probably. So, Senator, I really encourage you to be able to find a way, and I'm not quite sure how that works on Guam, where we don't have a lot of insurance regulation, finding a way to encourage employers and health plans to cover hemophilia. Other blood products as well. You know, it would be nice to be able to get blood for your transfusions when you have cancer and this kind of stuff, or accidents. But when I'm looking specifically at our community, I'm looking at trying to keep people in the mainstream through preventive medicine. And Dennis, if you know me at all, I stand for preventive medicine. That's what I make my living doing, is preventive medicine. And that's why this is close to me, is that this is one of those things that an ounce of prevention is worth pounds of cures. We've all heard that. And if we can just make this expensive drug available, enzyme, available to this limited number of people, it will make a difference in our society. It's made a difference. You attended our last hemophilia camp. You saw the community spirit among those people. And you saw the willingness of those people to give back to their community. And so I'm really glad that you've taken an interest in this. And again, as I see my colleagues here in the insurance industry, we've had meals together where we argue on both sides of the issue because we come from different points of view, and I understand their side as well. And that's why I say if there's any way that we can move the business community, insurance companies aren't going to pay for this stuff. They got to get paid for paying for it. And to move our business community to a point where the standard of care is as it is in the States. The standard of care is that factor products are not blood products. They're not. They're not even made from blood. They're not derived from blood. They are an enzyme found in blood, artificially made. Just like insulin is an enzyme found in blood, artificially made, factor VIII is no different. And it should not be excluded from coverage just because it happens to be an enzyme found in blood. Thank you.
Thank you very much, Doc. I think you provided very very powerful testimony, and so this is something that we're trying to do with this measure. We'll work with our friends and the insurance company to see how we can make this work. And maybe if it means carving it out further to make it deal with just this for now. It's piecemeal, but I know people don't like piecemeal work, but if that's what's going to take to move this forward, at least for this community, then we'll see if that's an option.
Well, but also there is a very definite logic to quit calling factor a blood product. Yes, originally it was derived from blood. And originally insulin was derived from pork pancreas or pig pancreases. But that isn't the case anymore. That's not how it's gotten. And the factor 8 that's being given isn't even the same factor 8 the body would make. Just like the insulin we give is not the same insulin. This is an enzyme just like the other enzymes that we've, growth hormone and estrogen, all those other things that we give. This is not like giving a unit of blood. It's definitely not a blood product. Although it is found in blood, it's not a blood product. And I think there's some sense for, in your bill you say cover blood and blood products. Well, yeah, that's a nice thing. But this is something that really actually shouldn't be considered that.
Thank you very much, Doc. Ms. Abala?
Yes, I'll speak brief.
We just,
My name is Rose Abala, and I'm an administrator from the Bureau of Community Health Services at Public Health. I'll speak to you brief, but I will talk to you from my heart. Back in 1996, there was no comprehensive hemophilia care program in Guam, and I was then a very young social worker working with medical social services. A social worker, we come across with patients who've been referred to us by Child Protective Services for children who have unexplained bruises. These young men were younger at that time, 25 years ago. It was then what prompted me to spearhead the efforts to develop a comprehensive hemophilia care program in Guam. We're very fortunate that we have committed people who wants to work with us to really address this. Back then, I made a promise to myself. I will only retire if blood and blood products are covered for our patients. It's my passion to help our community. I've seen the sufferings. You only heard 2, 3 of them, but we heard many stories from our families who have left the island sacrificing being away from their families to relocate to the mainland because they cannot get the care here in Guam. This is inhuman. This is not a third world country. This is Guam. This is a territory. So I know we have health insurance companies here, and I know they're trying to protect their business, but we are here to protect the lives of the people that we serve in this community. And Senator Rodriguez, we thank you for always championing the health of our people, and if this bill is passed into law, this is really history. And thank you for your efforts.
thank you very much, Rose. But you said something that you're going to retire if blood is covered. Then we may have to pull this back because we don't want you to retire. Okay, so okay, that's right. Okay, so thank you very much for your testimony, and we're going to work hard with our partners to see how we can move this forward. But clearly, it's something that needs to move forward, and we'll find a way to do it. Thank you very much. Thank you. I know the insurance representatives were not going to testify orally, but there were some questions raised about the federal coverage. And if I could call Frank, please, if you can come up. We'll just wait till you turn on the mic.
For clarification, Senator, some federal plans in the continental U.S. cover, like one of the Blue Cross Blue Shield plans, or so, and in certain cases, for instance, when you have a global package with a hospital, and if you're going to have a quadruple bypass, and if blood is part of that bypass, evidently you pay the global package. So in some circumstances, in the federal package, it is covered. Government of Guam is covered, as you know, and all of us in the commercial market is excluded, with some exceptions. Of course, one of the things that the doctor said, and I like what the doctor said, have employers extend coverage, and what that means, and is something that I believe it will be greater benefit for the people of Guam and the island of Guam, is to have universal coverage for the people of Guam. That way you can spread the risk farther, and you're able to assimilate some of these additional costs that are going to be needed. I mean, we feel for the community. I mean, but at the same time, everything that you add to a health plan has a cost, and we don't make those decisions. If an employer tells us, I want to cover blood and derivatives, we price it accordingly, and we provide that benefit. So at the end of the day, the story ends up with those who buy health insurance. And I think the story should also end with those who buy health insurance by having to provide universal coverage. And that's the extent of my testimony here today, Senator. The clarification of the coverage and the fact that the doctor is correct. Let's extend universal coverage.
Okay. Thank you very much. Does anyone, Senator or Jeff? No. Okay, yeah, and they do have written testimony. Maybe after you can speak to one of the representatives after the hearing. But thank you for that clarification, because it is in the intent portion of the bill, the findings, that we did have information, and Frank, we spoke to you about it. So to some extent, federal civil service health plans do cover blood products, and so, but I guess it depends on what. That's right, and some also in the commercial do cover. Understand? That's right. Okay, so we'll take all of this in, and we'll work. We're not going to just put this out. We'll work with them to make it something that's going to be acceptable. But knowing what the intent is to cover, ensure that the coverage is there for this community, especially. We'll move forward with that. Okay. So thank you very much. It's 4:08. This hearing's adjourned.